Throughout the morning, we listened to very interesting presentations from several colleagues and several countries about their experiences with cancer programs in general, and in particular cervical cancer and the HPV vaccination programs. But we were all focusing on the supply side. We listened to the government, we listened to UN agencies, and we can all have perfect programs in place. But when no one uses the program or they oppose it, then we are in trouble. Because already investments worth of millions of dollars or maybe hundreds of millions of dollars are put in place. So this session will be completing the formula of supply and demand. We discussed supply-related issues in the morning, and now how can we make sure and work with media, with civil society to make sure that people are on our side, people are convinced and starting using the service. For this, we are having 4 fantastic speakers, because each of them will be adding a different angle to the discussion and to the demand side of the equation. First, I would like to call Dr. Ibtihal Fadil. She's already here. Dr. Ibtihal is the chair of the East Mediterranean NCD Alliance based in Emirates. Dr. Malik Somai, he's the co-founder and president of Tunisian Center for Public Health. Dr. Ifat El Barazi, medical research specialist from UAE University. And last but not least, we cannot skip not having a young person with us. So we have Batul El-Wahdani. She's from Jordan, and she's the president of IFMSA, the International Federation of Medical Students Associations. And to our good luck, over lunch, I was sitting with Dr. Malik, and we learned that he was the president also of IFMSA in Tunisia and the board member. So it was really good to link between Batul and Dr. Malik to further, 10 years ago, to further enrich the discussions. So he'll be speaking with us as an expert now in the field, assistant professor of public health, from his experience with the Center for Public Health in Tunisia, and also linking to Batul's experience as the current president of IFMSA. For the first presentation, I would like to call on Dr. Ibtihal to join.
Good afternoon, everyone. I think this is, we call it the presidency session, since all are president and ex-president. So, where is my presentation? I will present a few slides. Basically, I think most of the issue we had talked about, talking about the role of or the collective action against cervical cancer, and leading the way to elimination of cervical cancer by 2030. Okay. Great. So I want to introduce 2 things. What are the WHO position regarding cervical cancer? Doctor, in the morning, he presented one aspect from HPV vaccination and the WHO position. I want to introduce something, another perspective related to cervical cancer, since I was leading that work in WHO. And we had achieved some of, like technical guideline for the region. And I want to share it with you. And I want also to talk about the role of the civil society. So as this in the morning, many speakers have mentioned about the cervical cancer and the impact of the cervical cancer. Nearly 90% of the death we are talking about here occur in women in low-income countries. In the region, cervical cancer incidence is regarded as low, and this is one of the concept myth why the people and most of the government we had met before, and people, the leader and decision maker, they don't take a serious action against cervical cancer. Based on ARC estimate in 2012, there is around 14,000 cases and the death in the region. And this was, as UNFPA colleague mentioned, it will be doubled. So WHO, most of the decision maker and Minister of Health asked WHO what are their position regarding screening, cancer screening in general. There is a work which started in 2014 by the regional office, and that work talking about which cancer we have to prioritize and what are the early detection and action should be taken against this cancer. Based on a series of consultative meetings and also consultation with countries, we come out with a document in 2016. This document, I invite you to read if you have time. It's very valuable and contain many of the insight and highlight the needed action in the region. So in this document, the WHO consider only 5 cancers to be discussed in the region as a priority, and these are cervical cancer is one of them. You have other 4 cancer, which is the breast, of course, and colon cancer, and something talking about the breasts and oral and head and neck. Why oral and head and neck and prostate? Because there is a lot of different action taken by Ministry of Health regarding these cancers, so the advice of WHO whether what are the needed action. In terms of the cervical cancer, which is our subject today, this is the policy statement from WHO, the regional office. And by the way, the Eastern Mediterranean is the first region globally to produce this sort of position statement on what should be needed to be done for cervical cancer. The policy statement basically says exactly what has been discussed in the morning. In the prevention side, most of the country need to consider HPV vaccination for the girls. And if they are not able to do it now, they should have a plan and make the resources to achieve that, the target for HPV vaccination. And specifically, talking about the high-income country, the Gulf country, they should start vaccinating the girls. For the early detection, also the position of the WHO recommend HPV testing and to be provided for women 30 to 49, and combining screening with a treatment of precancerous cases should be a requirement, and there should be a plan for treatment as well as a palliation. As I said, in the prevention, this is what they need to do, and the area has to cover to achieve high target of vaccination. So in terms of elimination of priority, we are talking about elimination here. Again, we are adopting a life course approach where we have to introduce the vaccine, and then the women make sure the screening is covered and increase early diagnosis and treatment of cervical cancer. Now this is what is the WHO recommended and should be considered by the country. One of the issue and the challenge you had mentioned, there is many, we know the know-how, but the issue how countries are implementing. So civil society is playing a great role helping countries and the government to implement what is recommended by WHO. We know in an area of non-communicable disease and cancer, no one can do it by alone. Ministry of Health specifically, they have to have all the sector together. So I'm talking about here the Eastern Mediterranean NCD Alliance. It's a group of civil society, non-governmental organization unite together. They create a coalition to support government in the area of non-communicable disease. I'm just putting some of the photo of our previous meetings and gathering. We had we started to work from 2016, and we have launched the Regional NCD Alliance in 2017, and we are still working in the region with increasing the number of civil society and NGO joining us in order to have one goal, to beat non-communicable disease. The area which we are working with, it's specifically in line with what we are talking about in area of cervical cancer, raising awareness, creating advocacy, making accessibility of the service. We have many NGOs, they are delivering services like the King Hussein Cancer Center. We have many in Pakistan who are all delivering the cancer care. And the area of accountability, I should say here, we are not very, common or very progressed in accountability, which should be in the future, because the civil society has to do the watchdog part and making the government and raising awareness and making the commitment happen as recommended or signed by the government. Why the civil society? Most of you know that the NGOs, they have many strengths, like they could be working as monitoring the action done by the government. They could be engaged with the government. They have a community rooted, which they can make it more in terms of awareness and raising the public awareness. They can work as a generator of knowledge through the research and creating a database. And they are also very much in way of creating a collaboration with different sectors. As I said, they are also regarded as a platform for dissemination of information globally and regionally. Civil society could accelerate action in terms of cervical cancer and the elimination of cervical cancer. So they could work with the government, advocate for national cervical cancer strategy, and which is aligned with the global requirement. Support country in rolling out the HPV vaccines. Support the voices of people living with cancer. And they are also create a good platform for raising funds for action and delivering of services. They are, in most of the cases in the region, we have many cases where they advocate for patient stories, and they can separate awareness and working with local authorities. And they are also contribute to the emerging elimination of, contribute the expertise of the emerging elimination program of work, which is working in hand with WHO for any emergency. So there was a call for action to eliminate cervical cancer globally, and as a civil society, we support that call for action, and we will continue working with the government in achieving that goal of elimination of cervical cancer by 2030. Thank you.
Thank you so much, Dr. Ibtihal. I think we cannot agree more that the work of civil society is well needed, and it's multidimensional, from advocacy to evidence to working with government to formulate laws, even in service delivery. As she kindly explained, some of the civil society organizations that are part of the alliance are already providing services, and maybe this is a good model that we should advocate for. But we hope in the discussion that we will learn more from Dr. Ibtihal and from the other colleagues, and also from the audience, about similar experiences to engage the civil society and to mobilize them to reduce the resistance to the program if there is resistance, and also to support the implementation and roll it out on a national scale. Now we'd like to go to the second presenter, Dr. Malik.
Yes, thanks.
Will give us also another perspective on the work of the Center of Public Health.
No, thanks everyone. Good afternoon. glad I'm actually after the lunch. I know that it's a bit tiring, but we're trying to go fast and stick within the 15 minutes presentation time. So I'm Malik. I'm founder and president of Tunisian Center for Public Health. I'm also assistant professor of biomedical informatics in US. So today's presentation, I'm just going to give a brief overview of Tunisian Center for Public Health. I'm also going to show some of the work we've been doing as a civil society organization, specifically around data science and how we build, for instance, an interactive and data dashboard on HPV for the region. Our work on advocacy, specifically in the Middle East, funding the Middle East and North Africa Coalition on HPV elimination. And last but not least is some paper research with some of our colleagues that I'm presenting on her behalf around the knowledge, awareness, and acceptability of anti-HPV vaccine in the Arab states and the Middle East and North Africa. So who are we? So Tunisian Center of Public Health is actually a non-for-profit organization founded in 2012, 1 year just after the revolution in Tunisia. And we work specifically on training, education. So we train people on HIV training and management, leadership, and also, for instance, in migration and mental health. We work also on disease prevention with other organizations. We do advocacy. We do also research and innovation. And I would target here around, we have tackling both innovation and research on these aspects, and we also collaboration and partnerships. So, for instance, as I mentioned, we train people in clinical management of HIV, and this is with the University of Washington. We have a global health innovation program also with MIT, and we do also leadership and management. Interestingly, we are also doing journal clubs on epidemiology, and we just launched a fellowship program which supporting medical students and other healthcare professionals to take a public health focus on their research for a while. We also have launched a blog, which is called The Voice for Public Health. So it's between an academic peer-reviewed paper, but also some kind of a blog advocacy programs. And we're inviting you, if you would like to publish something on the blog, to just get in touch with us. So one of the first work we did on HPV is actually building a data science-driven approach, trying to really understand the data. We know very much that the data today, basically for most people, looks at like this, like looking at research side, we're looking at what the healthcare services are providing in terms of data, looking at public health, disease surveillance platforms. But in reality, actually today, in public health, we need to have a bigger picture. We need to be able to understand public health using different variety of data. So for instance, we're using capabilities from policy and principles data. We can collect data coming from consumers themselves, for patients. We actually done patient satisfaction surveys. We can look at data from social media and other aspects. And the idea here is to have a better picture of public health that is not only entitled to the healthcare system only. So based on that work, we start looking at what that looked like. So for instance, one of the other aspects we did is actually trying to connect the different data. Trying to connect data coming from WHO, trying to collect data coming, for instance, from the World Economic Forum, and being able to match that data, trying to get insight and analytics, and then building on top of it something meaningful for the region. So having our own narrative. So for instance, we know that the Global Count 2018 is a global perspective, but in reality, we need to build our own narrative on that. So this is what we have built. So this is our first program. This is a specific dashboard you can access today by just visiting tuncph.org/en/HPV MENA map. And it's literally taken all that data, combining it all together, and actually running our own analytics on it. So as you can see, we have the entire region. We can actually look, for instance, we are interested to, I don't know how that works. Maybe? No? Where can I point? I don't know. Anyway, we're looking, for instance, we are interested in the region about national vaccine programs. So we made that clear that the first bar on your left, on the right, looks about vaccination rate, for instance. As you see here, you can actually look and change the national vaccination rate, and you see that the only green color here is actually Libya and UAE. We actually have the cervical cancer incidence rates in the region, and you can look at each country and look at the different profile for each country. So that was the first step. What we did also is actually to build a public health analytics specifically for the region. So this is also has been launched this week, and I'm really glad to have people who are largely contributed to this effort. Sylvia is sitting here. But what we were able to do is actually having a specific dashboard that you can visit and having access to the latest data in terms of numbers, so quantitative data, but also qualitative data, and data coming, for instance, from media. So as you look in here, so UAE, you see kind of a synopsis about the burden of the disease. You can look at the latest news and publications, and actually the different references that we have used. So we're trying to have this multi-data source approach to actually build something specific for here. So this work has been done, and in collaboration also with Ziad, who's sitting there. And this has been actually launched. So I'm happy to ask everyone who would like to join this effort to actually get in touch and trying to contribute and making this more sustainable. So we need a lot of manpower. So for instance, one of the key elements, as you're seeing here, that only Libya and the UAE are the only countries in the region that have the HPV vaccine in their national immunization program. Another work we have been working on is actually launching the Middle East and North Africa Coalition on HPV elimination. And that has been an amazing experience. I'm myself an academic, I'm not into advocacy. And when we started this initial idea, we thought that one of the key reasons is actually connect the people. Connecting people, sharing the experience, and actually we sharing the same problems. So just understand that we actually within the same mess to a certain extent, within the public health arena in the Middle East, is actually important. Oops, I think we jumped one slide. Okay. I think one slide is missing. Anyway, so you can join the coalition today by just visiting our website. Joining the coalition will allow you to have an access to our mailing list. So as for now, we have more than 166 members. All of them are academics. As you're seeing here, the mailing list is extremely active. So we have academics, NGOs, public health advocates, government members, and the debates are actually quite transparent. So everyone can have access to this, and I invite you all to join the group. The other work we've been doing is, and this is it's work done by Rihab Gamoun, so I'm making clear, she's a member of the Tunisian Center for Public Health, but she is also faculty at the School of Pharmacy in Tunisia, University of Monastir. And this is quite an interesting work. What she did was actually doing a meta-analysis, a peer review and a scoping review of all the publications in the Middle East around knowledge, awareness, and acceptability. And she published a paper, the paper is available online, and one interesting aspect I wanted to share with you is that there is only 18 peer-reviewed studied published papers between 2012 and 2016 in the entire region. So this is, I would say, quite low. So first argument is we're lacking a lot of research, at least in terms of public health in the region. Out of those 18, the first 3 are actually Saudi Arabia, UAE, and actually Morocco, who have been doing some work on this. So this is one of the key points. A second key point, which is quite important, is actually from this research, we found that there is low to moderate knowledge of HPV infection and anti-HPV vaccine awareness among actually the population, but also among physicians and medical students. So one of the key elements here is we need to be aware that there is a lack of knowledge about HPV, its causal relationship with the cervical cancer, and the availability of the vaccine itself. So there is a huge work to be done by civil society, not the government again, civil society and other organizations like the IFMSA present here, to actually work on raising that awareness among healthcare professionals and the public. Another important element, which has been mentioned earlier in the presentation, is that there is moderate to elevated levels of anti-HPV vaccine acceptability among the various demographic groups studied. I mean by this adolescents, but also parents and healthcare professionals. So an important element here is that despite the lack of knowledge about HPV, its causal relationship with cervical cancer, and the availability of the vaccine, there is a strong interest in learning more about the vaccine and actually the willingness to become vaccinated. So there is an argument about our policymakers most of the time that it's not possible to implement the vaccine program because the people are not yet educated, the population is not yet aware, and the population is not really willing to be vaccinated. That's wrong. So education and awareness is here are key strategies about HPV and cervical cancer in the region specifically. So the cultural barrier that seems to be the main justification for the lack of political will to engage in national cervical cancer prevention is unfounded. The last element is actually we just published today. Today was yesterday? Was yesterday, yes. The HPV and Cervical Cancer in the Middle East and North Africa review. And this is kind of a booklet. I think we have copies here available today, but also you can have it online. And it's actually an entire summary of the different publications, the different news, the different reports about HPV burden in the Middle East and North African region. And I hope that this is just a first effort to get the community more engaged and getting actually a voice to all of us who are doing some work here to get and canalize and actually diffuse this. So please, also again, this is a call for all of you to join the coalition. This is a call for us to actually collaborate. I think one of the key elements here, as you're seeing here, we have from all different countries in the region. We have expertise, I think, but the most important element is actually getting the same dynamic running. And I think it's a really good momentum in the region that we probably should be part of, and I'm really proud to be a part of this community. So thank you so much, and I hope I stick with time.
Thank you so much, Malik. This is really very interesting, and special applause for you for finishing before time, because we started a little late, so we'll try to catch up. And I really liked very much what you presented, especially the interactive map, because we find this as a very useful tool in general, any interactive map. I work for the regional office of the United Nations Population Fund, and we never wish to have a comprehensive picture of the region and what's happening. Interactive maps are the easiest and simplest way to have a quick glimpse at the region and see where the different countries are, and to use it for advocacy or for making other presentations. And congratulations on the launch of the report of yesterday. This is very interesting coincidence. I don't know, maybe it wasn't a coincidence. It was already coordinated. And last week you launched the analytics as well.
Yes.
So congratulations for these two events, which are very much related to the key topic that we are here together discussing and advocating for in the region. Thanks again,
Yes.
Malik.
Thank you.
In the era of social media and media in general booming and affecting everybody and every bit of our daily life, we'll listen to Dr. Iffat telling us about media and social mobilization in relation to HPV.
Thank you so much.
The floor is yours.
You can hear me. Thank you so much. I was hoping to use the 3 minutes that was left for Dr. Malik, but you took them. So thank you for everyone. Thank you for Dr. Ziad for inviting me to be here on this very, very important program and conference. Thank you for the Friends of Cancer Society and Dr. Sausan and for everyone being here. And actually, I like to start with a story. Usually I like stories, so that's why I will take more than 15 minutes. So last week, there was a story in the media here in the UAE. I'm not sure. Yes? Okay, that's good. I can hear myself now. So last week in the media, there was a story of a child who died after receiving a vaccine in Ajman. And the story was very trending on Twitter and in the media, even on these newspapers. And people started sending this message on WhatsApp. A child died because of vaccination. And this is really, I think, raised the alarm that we are joining the herd, I think, in the UAE, in the anti-vax movement. Another story was, just again, I think a well-known professor who was known even in the world of vaccination died in the UK. And the media quoted that this professor died after he received yellow fever vaccination. Of course, if you go down in the story, you will find that this person did not die because of the yellow fever vaccination. But the media quote this, and they said, okay, so it's vaccination which caused death. So I think we are now facing this big problem of people joining this anti-vaccination movement in the UAE, and we really need to work on this. And that's where the media is going to be used. Are we going to use it for negative or for positive awareness? So media plays a role in creating and shaping public health, and I think everyone can agree how social media now is really shaping our even way of thinking. An important factor contributing to the lack of knowledge about HPV can be related to the lack of news coverage. And I think this is why it's a very important topic I think I'm sharing with you today. And I think you will make use of what we have done in the UAE University in terms of the content analysis, which I'm going to present now. So after 2006, there was a media coverage increased in, around the world, not only in the UAE. And we found that after we started, the Department of Health launched the HPV vaccination, we thought, let's see if the media is really joining this campaign, or the Department of Health is working alone and the media is working alone. So we decided to go for the content analysis of newspapers, and we thought, and when I'm talking we were a team, myself, Dr. Tom Noni, and Ms. Hina Rahil from UAE University, who decided to go for content analysis for newspapers in the UAE, Arabic and English newspapers, and find out what was their coverage for HPV vaccination since the launch of the campaign in Department of Health 2008. So I'm going to present with you this paper. The paper is accessible online. I put the link for the paper. If anyone is interested to have a copy of the paper, you can contact me and I can send it to you. So we know that Abu Dhabi has launched the campaign in 2008. We know that there was at the beginning a very low uptake, and then the uptake increased to 95% due to their efforts. And this was published by Ortashi et al. At different stages. And we know that there was, according to Ortashi also et al., that there was no cultural barriers. And this was discussed in the morning. And again, when we have done our own study on HPV, on the screening knowledge in the UAE, as I said in the morning, we found that cultural barrier is not really a big problem in terms of HPV vaccination or cervical cancer. We found that maybe with the colorectal cancer can be a cultural problem, but with the cervical cancer we don't have really a big problem. So we decided to look at, as I said, at the newspapers that are prominent and popular in the UAE. So I had to go to a report on the media published in the UAE and published in the region to find out what are the most popular newspapers in the UAE that are accessed. So the primary aim of the study was to explore the content and communication style of the newspapers, Arabic and English, before, during, and after the HPV vaccination program. And that took place between 2012 2013. The paper was published later on, but that's why you will find that the newspapers that we accessed wasn't more dated than 2013, because this is the time we have conducted the study. We've done a systematic literature search, and we call it content analysis, which conducted on 6 national newspapers with the highest circulation figures in the UAE Arabic report. And we had bilingual researchers who helped us also looking at the content of these newspapers. The newspapers were Ittihad. I'm not here publicizing for the newspaper, but these are the newspapers that we have used: Ittihad al-Khalij and Imarat al-Yawm in Arabic, English Khalij Time, National, and Gulf News, which are the most popular in the UAE. So internet search engines, of course, we had to rely on the internet. We couldn't get access to the printed papers because of so many factors. So we had to look at the internet and look for and most all of these papers are available online. So we had to look for the internet, for the papers on the internet. And as I said, we looked at papers that was published from 2000. We chose 2000 because this is when I think the public health has really peaked in the UAE, from January 2000 until 2013. And we used 3 different terms: HPV, human papillomavirus, cervical, during our search. And we looked at specific types of vaccine to find out what are the published articles related to HPV and cervical cancer. So we looked only at articles that discussed cervical cancer screening, prevention, and vaccination in the content analysis. So any papers that did not discuss these 3 main topics were excluded from our search. A total of 79 newspaper articles, 31 Arabic and 46 English were included in the study. Period from, as I said, from January to 2013, from 2000 to 2013. Overall, 59% of the articles were published in the English newspapers and 40.5 were in the Arabic newspapers. Which is, again, very typical of how the media is portrayed in the UAE. In the Arabic newspaper, the distribution of the articles was 53%, in Emirat al-Yom 37.5%, in Al-Ittihad 9.5%, in Al-Khalij. And there are more, I think, information that you can access through the article. So we've done descriptive statistics. Each article was examined to inquire about the frequency of general information about the HPV vaccination, the type of sources we've referenced in articles, and headlines of the messages. And we tried to code the themes. We have done it as a thematic analysis, and we code the themes that were the most common in the newspapers. The researcher attempted to gain familiarity with the article by recording and reviewing them to gain a deeper understanding of the health messages. So you can see what the breakdown of the newspaper articles by year and by newspaper. You can see from 2008 until 2013, there was a peak in the articles that was discussing cervical cancer, and this is after the launch of Abu Dhabi vaccination. I think we'll just go to more. I will not go into details. In the English newspapers, there was a fairly constant number of articles published about HPV cervical cancer, and it peaked usually always March, April, and May 2012. This tells us that there was some really information that was like disseminated by the Abu Dhabi, Department of Health. You confused us with the Department of Health and that. So Department of Health, and I think the media was picking up on the importance of the cervical cancer vaccination. However, in the Arabic newspaper, we find that the spike was in 2013. So they started following after that. And you can see here, this dotted line shows us how, like the most in, I think it's April 2008, when the vaccination started. And this is how you can see the distribution by month and by, I'm not sure if it's clear for you, the slide. It's too light, I think. But it tells us again how there was a spike in the information about HPV vaccination. These are the themes that we found: the HPV screening or vaccination program in the UAE, and there was 30 articles; cervical cancer statistics in the UAE, and there were 22 articles; etiology of cervical cancer and HPV vaccination efficacy; cultural sensitivity and misconceptions surrounding HPV in school-age females, only 8. And I think we should highlight this theme, which is about the acceptability. Only 8 articles from newspapers have discussed this important cultural issue. And cost effectiveness, efficacy, and safety. Again, only 7 articles out of 79 articles. It can tell us that we had a bit weaker discussion from the media for these 2 important topics for encouraging people for acceptability and for uptake for the vaccine, which are the cultural sensitivity and the efficacy of the vaccine. So this is, again, by a number of articles, the themes, the same themes. This is the link for the paper, if anyone interested. I took screenshots of, this is again in the supplementary material of the paper, screenshot of some of the articles' topics, and with their links. So if anyone is interested really to access these articles, you can just go on the paper and access the link. So if you look at the English, this is an example of the English ones from 2011 to 2006, and you find the topics, for example, mostly reporting on some activity and campaign going on in the country. While in the Arabic ones, again, reporting on statistics, again, reporting on certain campaigns. So we find, according to what we found, it was very superficial. What was happening in the media did not go really in depth into trying to convince people to use the vaccination or to discuss the cervical cancer and make people understand really what is the impact of cervical cancer. And I think this is the message I might pass to the Ministry of Health, that I think the media role is very important. But the way the media is going to portray this message that you are trying to pass to the people, it has to be really in depth. We have to use more models of behavioral change, more information on how to disseminate information and how to convince people to start adopting our messages. I think I missed something. This is some of the findings, as I mentioned. They did not go really into the, as I said, the efficacy and the cost effectiveness of the vaccine. And I think one of the messages that the Ministry of Health should really disseminate to the people is the efficacy, how the vaccine is not really going to cause death and to cause side effects again, and how this is not going to affect our cultural and Islamic background. I'll skip this. One of the major strengths of this study was the inclusion of papers from the 2 different languages. However, we were not able to access social media, because if I want to go to social media, it might take me maybe a few years to find out what are the messages. But again, I think social media is now our weapon to use to really propagate for the vaccination. I can tell you the WhatsApp messages that was circulated the last week for this child was really telling people vaccination is the cause of the death, although there was no proper investigation yet happened. And I think I will stop with another story. I'm not sure if also any one of you have seen this story of a lady who, it was on Twitter, very big title says, "My son died after she received or he received vaccination." And you go down in the comments and you find out that this lady said, the child received the vaccination a couple of hours ago, and then she went home. While she was playing outside the house, a car came and struck the girl and died. So it wasn't the vaccination, right? Then in the comments, one of her comments was, the vaccination contained heavy metals, so my child was attracted magnetically to the car and died. Yes, you would laugh, but believe me, some people believe this. Unfortunately, this is what's happening. I think I've said my recommendation. I have to stop here, but let's counteract it. I think people are really affected by this big message. They don't read the details. Whatever you tell them, they might accept it. So let's really use the media properly and effectively. And thank you very much. Thank you. 0. Thank you.
Thank you very much, Dr. Atemed, and for sticking to the time as well.
0.
So the presentation is a little heavy, and she skipped several details so we can finish on time.
Thank you.
Especially, I like the heavy metals theory that the child was attracted to the car. And this is unfortunately what's happening. You see people on social media, they just click like and share without reading whatever is inside it. So this is a very high risk, and we need to be monitoring and tracking whatever is put on this. And it requires a lot of money and time. If you have someone dedicated to be monitoring social media and responding to whatever rumors that or inaccurate information that people spread on it. Which brings us to the point that Dr. Shibl and Dr. Kamal also reiterated in the morning about having a communication strategy, a clear approach from the beginning. Don't just wait until the crisis happens and people criticize and you are under attack from everywhere. Then you start to think about, okay, how can we respond to this? From the beginning, start late, as they said, but start right and be well prepared. Now, this will take us to the last presentation. I know, for me, I'm very happy that Batul is with us here because of 2 things. Batul is the president of the International Federation of Medical Student Associations. So she is a doctor to be, inshallah, very soon she will be a doctor. And her peers are the most important category that we were talking about in the morning. It's them who will either carry the flag and move on with it or resist and say no or pretend that they are fine with it, but then when it comes to practice, they will be putting obstacles in front of the program. we'd like to welcome our dear colleague Batul and listen to her. Welcome, Batul.
I don't like to use slides because when I thought about making slides, I only needed one slide, which is the title of this meeting. How can we turn the tide on HPV and cervical cancer? And when I asked myself this question, I thought to myself that turning the tide means that you need to be courageous, you need to have an unconventional way to act against the system, and you need as well to be creative and innovative. So I came up with 3 answers as a young person to this question, and my answers were, first of all, utilizing the power of the younger generation, and the second one is being and acting against the norms and the patriarchal systems. And the third one, and the most important one, is having a wholesome and a bigger picture approach. These may seem very general answers, but actually, and they may seem as well out of the blue, but actually they are a shortcut to how to solve the issue of HPV and cervical cancer. So let me prove it to you. It's a fact that we live nowadays at a time in which health is no longer the state of absence of disease. That health is becoming a lifestyle, it's becoming a choice, and most importantly, a human right. We live at a time in which people are empowered to take healthy decisions and to act against those with the negative determinants of health. It's a fact as well that we live in a time in which we hear sentences literally every day saying that young people of today are the leaders of tomorrow, or saying that nothing about us without us, or saying that everyone deserves a table in the decision-making, a seat in the decision-making table. All of these slogans resonates high in the high-level meeting rooms between Geneva and New York, in the assemblies and in the world meetings. But what actually is happening as well is that the younger generation or young people are becoming more and more apparent on the global level, on the regional one and the local one. Youth and student-led organizations are becoming more and more recognized. They are fighting and advocating to have a more meaningful youth approach in global health agendas. So how does all of this relate to HPV and cervical cancer? It's not out of the blue. Youth are a very important population platform for HPV. As a fact, each one of us who are present here know that they are a key population to solve this issue, because when we are talking about vaccination, we are targeting the younger generation. But maybe something that everyone knows as well is that they are as well a stakeholder and an actor in this. And how can they be a stakeholder and an actor in this? Let me give you an example from the organization I come from. I come from an organization which is called the International Federation of Medical Students Associations. It represents 1.3 million medical students in 125 countries around the world. And we do a lot of advocacy efforts and campaigns with medical students everywhere. Our vision is to have a world in which medical students unite for global health and are equipped with the knowledge, skills, and resources to take on health leadership roles locally and globally. So these are fancy words, but why do we need them? A very simple answer, because literally from the morning until now, every single session we said that the biggest resistance in HPV are doctors and health workers. And if you want to solve the problem, it's only smart to invest in them at an earlier stage in their education while they are still students, while they are still building their attitudes toward healthcare, towards their own patients. Being a good healthcare provider does not start automatically by being enrolled into the labor market. It starts by the roots of education and the roots of training, by ensuring that social accountability, the needs of patients and populations are reflected into the trainings and minds of our future healthcare providers. So therefore, in our organization, we adopted a few set of priorities, and one of them was sexual and reproductive health and rights. And the reason for this is that even medical students who have all the knowledge in the world, there are still discrepancies in the knowledge about comprehensive sexual education between medical students and health students, between countries, between universities, and between communities. And you cannot solve the issue of HPV and cervical cancer with enabling vaccination and having them accessible to everyone, or by ensuring that people know about screening. You need comprehensive sexual education. You need a more preventive measure to the younger population from an early stage. We conduct advocacy campaigns and voluntary campaigns spreading awareness to our own colleagues, starting from medical students themselves to early career professionals and as well university students and the general population. We have conducted recently 2 campaigns in Lebanon and Morocco in collaboration with Global Health Strategies about HPV and vaccination and screening. And as well, we work on advocacy, which is as a fancy word that is growing nowadays within the population of the younger generations, which is participating in decision making. We organize our voices into policy documents, and our first policy document on HPV vaccination is coming up in March. And it's really important because not everything that is inside this policy you will find it anywhere else, because we talk about access for HPV vaccination to marginalized populations. We talk about the stigma related to it and the relationship to gender equity and empowerment when it comes to talking about HPV and cervical cancer. And now we go back to the same title we started with: how can we turn the tide against HPV and cervical cancer? And the second answer was having a wholesome approach and a bigger picture approach. In the high-level meeting rooms all over the world, they discuss universal health coverage, non-communicable diseases, communicable diseases, gender equity, and such bigger issues. And HPV might seem a smaller one in comparison to them. But what we actually need to keep in mind is that we will never be able to tackle HPV without trying so hard and fighting to integrate it into each of those global agendas, because governments and political systems are fascinated by these bigger agendas and they forget about the smaller ones. But if you want to solve HPV, you need affordable access to vaccines. You need gender equity and you need gender empowerment so girls can go there and ask for their vaccines. And you need at the same time to teach them about the preventive measures of non-communicable diseases, having cervical cancer, and how to prevent STIs, being HPV, having it as one of the sexually transmitted diseases and infections. And the third answer to the question that we had at the beginning, which is turning the tide against cervical cancer, is breaking the norms and the patriarchal systems. And what do we mean by that is we do not want to solve the issue of HPV by creating another one. And creating another one is by only making it known that HPV vaccination is a female vaccine. We are just contributing to the patriarchal systems that makes it look like that females and girls are the ones responsible for prevention and for sustainability of health. We are as well preventing other marginalized groups, including men, to be able to access this vaccine as equal as the girls around us. We cannot contribute to this. We need to move forward to and transfer to gender equal and what we call them gender neutral vaccinations, which are affordable and accessible to everyone. In the end, there are so many ways how we can turn the tide against HPV and cervical cancer. But in order to do it in the shortest and the fastest possible way, with the least efforts and the more sustainable way, we need to be controversial, courageous, and take different approaches. Thank you.
Thank you so much, Batul, really, for this very courageous presentation. And the way really you were talking was very engaging, very energetic. Really, thank you. Not only as a president of IFMSA, but as representing a huge portion of the Arab populations. More than 50% of the population in the 22 member states of the League of Arab States are young people below the age of 25. So we're talking about hundreds of millions who are below the age of 25. And Batul is very welcome to have shared with us some of the passion and the energy that young people bring to any discussion or presentation. I'd like to put Malik on the spot because, as I shared with you earlier, he was an IFMSA president in Tunisia and also a board member. So in a couple of minutes, if you can relate this discussion to the role of medical students in your previous capacity, complementing what Batul has shared with us.
Yes. No, I mean, I'm really impressed and very proud to be part of the IFMSA. I mean, 10 years ago. I think it's critical for various reasons. First, as we discussed, I mean, HPV vaccines and all the public health movement in itself has to do a lot of raising awareness, but also more specifically actually raising the level of our capacity to look at the problems. Like HPV is one of them. But as we're moving forward, we need to enable healthcare professional students actually to be critical to the public health, to the policy strategies, to the global health movement itself. And I think that's a critical element. And I think the IFMSA, from my experience, was a real window to that. I mean, I've been trained in Tunisia as a medical doctor. We only been trained to treat diseases. We never had to manage or actually look at the patient. So the patient was actually a barrier. I had to just to treat and actually being in attack with the disease itself. Public health was not taught in the program. Ethics, for instance, human rights was never trained. So I think the IFMSA was actually a great window to escape, and through which we can look at the bigger picture of public health. And I think the IFMSA was very helpful not only to outsider community, it was actually to the people who have been part of that experience. So I'm sure that IFMSA has created a huge leaders. I mean, we've been discussing about our common friends who are actually at the UNAIDS and other organizations, the WHO, other organizations, most of them have been trained at the IFMSA. So it's really important to look at that movement as being student-led and actually student-fostered and actually being revitalizing the energy. So it's actually a community that changed every single year. So it's like the most long members are actually only for 1 or 2 years. So that kind of creates an energy and a movement and a wave in itself. So that's a very powerful thing, yes.
Okay,
Yeah.
thank you so much. And sorry again for putting you on the spot. We have listened to our 4 amazing speakers sharing with us different perspectives, the regional alliance, a national effort that is becoming regional also and more interested beyond the borders of Tunisia, then the study on media and its role and the risks that it brings with it in the era of social media, and then from Batul and the voice of young people and young medical students. By this, we'd like to open the floor. We'll take 3 by 3, then the panel will be. So I have Dr. Kamal first.
Hello. Yeah, thank you very much. Thank you very much for the panelists for this very interesting discussion. Actually, I just want to share 2 thoughts that I have in relation of these very important elements, which is social mobilization, community awareness. First, I'd like to start with the last presenter, Batul. Actually, I like to congratulate her on tackling many things. Actually, she brought my attention and convinced me how we can get one more resource. And this initiative is getting use of the smart, intelligent, active youth, especially the medical student and specifically girls. Actually, it brought me back to my initial career before joining the WHO as a university professor, and at a certain point of time, we wanted to upgrade and update the curriculum in public health, putting a chapter related to sexual health as a part of reproductive health. And we faced a lot of resistance. And then a big name in the School of Medicine saying that, why we should include the sexual health? Do we have a digestive system health? Do we have an endocrine system health? What is this sexual health? He was not convinced at this point of time that the entrance of this is to get what we are now is health. Everything is health. We need to focus on that. Another point, which is the need of having a very good ACSM, advocacy, communication, and social mobilization plan for this HPV nowadays, with the people who are social media oriented. I was discussing with Dr. Ben Azouz, who is now preparing for a plan, having high expert in doing social mobilization plan. Do we have to recruit social mobilization and community awareness communication specialists? But it should be aware of social media. Who is going now on the social media doing Facebook pages, tweeting every single minute, going to all these social media? Are they Coca-Cola company? No. Our heads in WHO, they go tweet every and each day, and they have specialists for that. All very big international organizations, they have Facebook pages. We need to build these kind of shields before introducing the vaccine. We do not wait until we have even a crisis management plan. After we introduce the vaccine, and as Dr. Ifat had said, we were waiting for someone to die and try to find the undersecretary coming in the media saying, no, 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 try to defend as you are doing a crime. No, we have to upload the social media from now, before the introduction, in order to get the right information. Only this year, last word, only this year in Canada, in one of the big provinces, they started to introduce what's called sexual health among elementary school students. They were faced by big challenges from the parliament. And then the reason of the Ministry of Education saying that it is better to give us this young generation with a material which is proofread by medical doctors rather than they get their information wrongly from the social media. Social media is always for ahead. We need to run before the virus like in polio. We have to run before the social media coming to attack us before we introduce the vaccine.
Yes.
Thank you.
Thank you so much, Dr. Kamal. Yes, I see it, Dr. Rastawi. Yes, Dr. Please.
I would like again to thank the speaker for very clear, good presentation. In particular, the medical student. I am a professor and I have a lot of medical students. In pediatric, of course. I think we made it compulsory that the vaccine program is taught in our medical students at different levels. I myself, I remember, my first contact with vaccine, it was in 1973 when I was asked to give a plenary lecture to my university about vaccinology, and I still have the slideshow of that, and I didn't know how did I write it, but it's still valid up today. I think medical students ought to be directed, and even in our exam, I think all medical students will be examined in the vaccine program. Of course, we are very proud of our vaccine program, but they have to know it by heart. And I think all students know that if they don't have exam, they'll have difficulty getting out of the exam. I think vaccinology is taught at pediatric, in civil session, and also in the community health department. I think we shouldn't fear HPV and related to sexual life and whatever. If people are worried about their health, I am basically a consultant pediatric endocrinologist, and I see a lot of endocrine problems related to puberty, and some of them are related to cancer. I mean, when you ask any young man or young lady to undress himself, he'll do it without hesitation. Because if people get the message that this is a life-threatening and this is a problematic, I think they will accept it. And I think there is a lot of work for us to do to reach that goal. Thank you very much.
Thank you so much, Dr. Rastawi. Any other questions? Okay, I don't see any hands, so I will take the opportunity then to ask a question that I had. The question is to Dr. Malik and to Dr. Ibtihal regarding advocacy. Have you had any experiences using any of the tools that you told us about in the presentations in upward advocacy with policy and decision makers? How did it go? What were the challenges? How did you overcome it? If you can give us specific examples on this.
Yeah, I think, in this area which we need to understand, we are talking about elimination. I lived in a stage where, in age where people in medical school, we used to see cases of smallpox, and we see cases of vaccination of smallpox. Anyone have seen smallpox now? It's eliminated, a disease which has been eliminated by a public health intervention. So, when I talk to policymakers and say, I'm not worried about the incidence and number of cases of cervical cancer, because this is the challenge. This is the area which most of the people say, we are having a low incidence of cervical cancer, let's focus on other. We are talking about a cancer which can be eliminated. A cancer, any one of you in the room have been touched by cancer. Even if we have one case of cancer, it is a big issue. It's a social, economic, and everything. So my message always is this is a cancer which can be eliminated. You can do something by $1 to eliminate the cancer, and that is a great message to give. The issue of civil society. The civil society, the example of this meeting and gathering is one of the examples where the civil society is voicing the issue of the FOCB is partner of the regional alliance. Tunisian Public Health is a regional alliance. So it gives you exact example how the civil society can voice and advocate for something like it's recommended globally, like elimination of cervical cancer. And I can refer to many other examples in this direction. The work of generating data, talking to the media is another example also of how we can share in the fight of cervical cancer.
Okay, thank you so much. Dr. Malik?
I think from my perspective, as like Tunisian Center for Public Health, I think the governments today at least are using quite an interesting narrative, which is a data-driven narrative. It's like they like to have more data. They're interested into data-driven policy-making process. So I think it's an opportunity for us actually to take that as a chance, as a channel to open a bidirectional communication. So the way we developed, for instance, the dashboard is actually to enable policymakers to have first a conversation with us on the same ground. It's like we share the same data, we have the references, we do our homework first as NGOs to actually build the data, build the platform, and then we do our work to actually share that and having a conversation with them, and they're using that as for them as a tool too. So we're making, for instance, the data that we are analyzing, we're making the data available for the government to use it. The challenge we have, though, is actually most of the government data is not accessible. So, for instance, we would have loved to have the data that we presented today at the regional or local level. That would be extremely important, for instance, to drive policymaking towards decisions. I think that's still a challenge. The challenge of how we can exchange data, for instance, and how we can use it to actually policymaking at the local, regional level would be extremely important. And I think that's still a challenge for us. I think also governments today are more keen to collaborate with NGOs and CSOs. I think civil society in the region has been stronger and stronger and still being actually moving upward. So governments today realize that those organizations exist and they need to collaborate with because they're bringing value. So I think it's a very positive. What is lacking though is, for instance, for our dashboard, we have loved also to increase more data from local research scientists, local academic centers, other researchers to build up our data locally, which is a challenge. And I think that's going to be critical as we progress in HPV programs. We need to provide evidence that this is efficient. And I think building up that research capacity, building up that collaboration pipeline and the data pipeline is important for us. I think it's just a very small example within a very small organization, which is ours, but that proves that there is a huge potential. And I think that's a key element. And I'm probably a scientist myself, so that's why I advocate for a data-driven approach. But I think that's one of the solutions.
Yeah, thank you so much, Malik. Batul, you have the floor to react to the comments that came from the colleagues.
Yeah, so I think like one of the things that we faced when we evaluated for medical students, the amount of knowledge they have is the discrepancies and how much the amount of like the cultural things that are happening in their society reflects on their education, which should not be the case for medical education. For example, for me as a medical student, I have never seen a case of a vaccinated female for HPV in my hospital. Yes. But I heard about it, I studied about it, and I studied much more about the screening, the stages of cervical cancer and treatment and so on. So what we're trying to do is that we need to tackle that in the younger generation. We need to implement it from an early age because it's really hard once you get into the system and you embrace the ideas of the system to fight against it. And when we speak about advocacy, policy making, and so on, a lot of people who are very active in advocacy and policy making, they became active much more when they became very developed in their career and professional life and moved forward. But we're trying to start this from an early age, as soon as possible, for students themselves to know what is advocacy, what is policy making, how they can take part in it, and how that being a good healthcare professional, you need to understand about health economics, human rights, education, and social determinants of of health and such things, which are not easily taught in our universities, and with the focus of scientific education much more on other topics.
Can I actually take on that? I think one of the examples we have recently is actually medical students, healthcare students are actually very keen to learn. Like, you can't believe the number of students who are keen to come on weekends, to come on like on afternoons, days, to actually get training programs. So even though we go to a medical school and it's like, no, they're too busy, they're not keen, it's actually when you contact directly medical students, the number of them who wants to learn about statistics themselves, like doing data science or doing like quantitative research, economic analysis, it's just enormous. Like, we just recently had like human rights and mental health training program for residents in psychiatry. The number of people, like, we were overbooked by like 5-fold. And the number of people who are keen to collaborate is actually enormous. So, and extremely knowledgeable, very keen to collaborate. So I think this is important to learn, is that we just need to jump on board and get them to touch directly. Yes.
Just I wanted to comment on, we're teaching in College of Medicine, we're teaching medical students, and lately we introduced to them the debate on vaccination and anti-vaccination. We teach them usually at the second year health promotion and how to run health promotion programs, and this is really very proven that it has affected their knowledge and their ability to start thinking about health promotion. But in the 5th year, we introduced now the debating topics like vaccination and anti-vaccination. And I hope we will evaluate this later, but I think this is a way to introduce really, to make the students involved and to feel that this is something that they have to really discuss with themselves, their own beliefs and their own attitude, in order to really be able to affect their patients later on. So I hope this will be in all other colleges, not only in our college, but I wanted to share this with you. Yeah. It's been really good.
And it's really good because I do not recall that in the medical school we never had any sessions to debate or to have these negotiation skills or communication skills. You just learn pure science in the college. But when you come to the real life, you realize that it's not enough to have the science in your brains. Any questions before we close the session?
Yes.
I'm sure you all feel tired. It's getting late.
That means that we passed the message.
You passed the test. Yes.
That's true.
Thank you so much, esteemed panelists, and we wish you a pleasant afternoon. Thank you so much for your audience. I believe we have...
Thank you very much for being with us today. I have 2 announcements for you. The first announcement is, after this session is finished, this is the last session, you can all go to the registration where you can get your certificates of attendance for today. And the second announcement is the outcome paper of this forum, which we have called the Sharjah Declaration on Cervical Cancer 3x3. You have in your folder, after the program, the paper for the Sharjah Declaration. I'm not going to go through it, but I'm going to explain why we want to do it. Friends of Cancer Patients, as a civil society, would like to initiate this declaration, which is a pledge, both personal and organizational, that any one of you, and I'm hoping all of you, will be taking today. We called it 3x3 because in the declaration paper, you have 3 things that we already know and need to do to achieve a cervical cancer-free world, which is to collaborate together on introducing vaccination, to strengthen healthcare services, and to empower individuals. And in order to do that, we will commit to 3. We will commit to 3 things, which is advocate for regional and national cancer strategies aligned with global initiative, establish cooperative capacity building, effort to expand countries and organization cervical cancer around control activities, and to work with partners to develop and implement innovation technology for screening and pricing policy to stimulate increased vaccination and screening coverage. I would like, in front of all of you, to be the first to pledge that I'm going to do that and take the Sharjah Declaration. And I hope all of you will be pledging today. I pledge as an individual, and I'm sure Mr. Jaffer will pledge as an organization. And I would love all of you to pledge that and to carry that forward till we next meet, inshallah, in Sharjah for the same topic and see where have we been through in our journey and turning the tide in cervical cancer. Please take the pledge. So say after me, I commit to advocate. I commit to establish cooperative capacity building. I commit to work with partners to develop and implement innovative technology for screening. Thank you very much. Welcome to the Sharjah Declaration. And finally, with all pleasure and without further ado, it gives me great pleasure to welcome Her Excellency Sausan Jaffer, our President, to come and give the final remarks of the day. Please, Your Excellency.
Honored guests, ladies and gentlemen, as we conclude today's forum, I would like to thank everyone who so ably helped put this transformative event together. Thank you all. You have all chosen to be part of this day and show your deep commitment to HPV and cervical cancer prevention, a commitment that unites us all and brings us that much closer to eliminating these entirely avoidable and preventable diseases. And of course, now we know they're also curable. On behalf of Friends of Cancer Patients, I convey my special thanks to our excellent speakers, panelists, moderators. Your enlightening and powerful contributions and continued partnership in our collective endeavor is deeply appreciated. As we work together towards achieving disease prevention and related cancer control protocols, your critical leadership and insights will surely help turn the tide against the growing menace of HPV and cervical cancer in the UAE, indeed in the whole of the MENA region. As already cited by Dr. Sausan Al-Madi, Friends of Cancer Patients has pledged the commitment to implement the Sharjah Declaration on cervical cancer by working for better access to screening, vaccines, as well as treatment of HPV and cervical cancer throughout the MENA region. I earnestly call on all government, academic, research, and medical bodies, and indeed advocates, to unite in this commitment and join us to take concerted action nationally, regionally, towards achieving our goal of eliminating these conditions. Working collectively in this manner will surely achieve our goal for the benefit of all. This Sharjah Declaration is indeed well-timed, given the recent call to action by the World Health Organization for a coordinated global effort to eliminate cervical cancer, which is undoubtedly gaining traction as a global priority. For far too long, for really far too long, cancer has been greatly feared affliction that comes at enormous cost to society, affecting many lives in deeply distressing ways. Today's forum will hopefully serve to ameliorate this by uniting key stakeholders through the Sharjah Declaration and community leaders, scientists, and policy leaders to enhance and strengthen our collective national response and movement to HPV and cervical cancer. Thank you for being part of this great movement.
Thank you, everyone. Thank you. I think this brings the whole event to an end. I want to express my appreciation for all the partners that worked very hard on putting this event together. I want to thank everyone who traveled from very far and who went through the visa, the tickets, the planes, everything to come all the way here. I'm really grateful for the time and the commitment you have for this cause. In order to end this event in a nice way, I think I'm going to invite everybody to go on stage, and we're going to have a group photo together. And then at 5:30, we have the reception at the terrace, so that way we can continue the conversation in a nicer environment and continue learning about cervical cancer and HPV. Thank you so much.